This week marks Black Maternal Health Week. Healthcare providers and maternal health advocates all over the country are shining a light on the issues Black mothers and mothers-to-be are facing every day, including right here in Metro Atlanta.
And our very own Faith Jesse joins us tonight with more. Faith?
Yeah, so when we talk about the state of maternal health care here in Georgia, it's just not great. Historically, it hasn't been great for all women, but especially Black women, who are 2 to 3 times more likely to die during and after childbirth. And tonight, I'm bringing you part of a conversation I had with Dr. Madeline Sutton. She works at Grady, and she's speaking about the barriers Black women are facing while trying to get care. And what impact is this having on Black women here in Georgia?
It's one of the things that a lot of studies show women have in common in terms of challenges to access or late diagnoses. Certainly there's provider bias, but there's also some other systemic racism factors that are impacting it. And so whether you're talking about disproportionate access to educational opportunities, employment opportunities, things that could allow someone to more easily access appropriate types of health insurance coverage, and that includes Medicaid, those things disproportionately negatively affect Black and brown women and other birthing people. Some of the things that we can do to resolve that, certainly Medicaid expansion in the states where they haven't done it yet would allow more women to be able to access care earlier if they choose to. And one of the things that we're having success with is more extended postpartum coverage. So traditionally, postpartum care had been defined as up to 6 weeks. And as we know, maternal mortality can include deaths that happen up to a year after being pregnant. And so efforts that are successful to expand that postpartum coverage to up to a full year will also, I think, have a huge positive impact on women's access.
And Faith, you mentioned that maternal health here in Georgia isn't great, but how does Georgia compare to the rest of the nation?
Yeah, so it's not great at all. When you're looking at Georgia and comparing to the rest of the nation, actually historically ranks among the worst states in the country for maternal health. According to Dr. Sutton, Georgia and Louisiana are really neck and neck for the highest numbers of moms dying during and after childbirth. That's the maternal mortality rate. And right now, we're currently waiting on the Department of Health to release its latest numbers on the state of maternal health here in Georgia. So when we do, we're going to have that concrete data, and we'll have a better understanding of what can be done to change that.
Yeah, obviously, a lot of work still needs to be done.